Well, the teaching technique is, I guess I would say this. I think I'm very passionate about schema therapy.
Mm-hmm.
And so my goal is always to make sure that both my passion and my enthusiasm for the model get delivered to the audience. I want my participants to, I think that when people sense my own passion and experience, along with teaching theory and strategies, anyone can teach, I think almost anyone can talk about theory and strategies. If you really believe in it, then you're going to deliver it like a good schema therapist would do. You'll deliver it in a way that's real. So I like to make it as real as possible, which is why I use a lot of demonstration. I demonstrate the patient, I demonstrate the therapist, I demonstrate the struggles. My teaching technique includes, I think, an empathic appreciation for the fact that it's hard. We work hard as therapists, especially as schema therapists, because we are reparenting agents. And that work is like being a parent. It's very important and it's very difficult. It's very challenging. And even more so because we're taking on patients who have very often these very wounded child parts of themselves. So I want therapists to know that I appreciate how hard the struggle is. And I don't want to just show them perfect situations where it's easy. I want to show them the struggle. I want them to be able to know that we all have to be able to respect the fact that this is hard, even though it might sound easy when someone says, just be yourself, be real, be honest, be open. Help your patient to feel you're caring like a good parent and your guidance. It sounds easy, but it's not so easy when most of us are trained to be more distant, more, I don't know, like the tabula rasa, more
Yes.
blank slate. And so in schema therapy, it's important to stress the helpfulness of being a more genuine, real person.
That leads us to the topic of self-disclosure, of course.
Mm-hmm. Mm-hmm.
And how do you teach people, beginners? How do you teach beginners the limits of self-disclosure?
The basic rule is just to remember that whatever you're going to share should be for the benefit of the patient. There's nothing that we need to share with a patient that isn't going to benefit them. So my patients aren't going to benefit if I suddenly start acting like a friend, because a parent isn't a friend. A good parent will share information that they think is appropriate for a child to hear. So when I'm speaking to a patient, even though I'm looking at an adult, I'm looking deep within at a little child that's troubled. And if I want that little child to feel safe to come out and connect with me, then I can only share things that I know the little child is prepared to hear.
Mm-hmm.
So the general rule for self-disclosure in our model is that you only self-disclose if you believe it's something that is relevant to the needs of the patient. It's not about us, it's about them.
Mm-hmm.
So and it might add to my empathy. It might add to my ability to show up like a representative of their real world. In other words, I can react to something they're saying to me, like a narcissist might do, in a critical way. I could react to it like a real human. Instead of just talking about it theoretically, I can react to it and say, wow, that's pretty harsh. Oh, that hurt my feelings.
Mm-hmm.
Like a good parent might say to a child, but without becoming overwhelmed, without falling apart. And I can appreciate the relevance of my reaction to their needs because it's probably a representation of what it's like for other people in their life. So I take my own reaction and I try to imagine with them what it's like for other people who aren't trained to understand them. So self-disclosure can be reaction. Self-disclosure can be sharing something about yourself that connects with their experience. But it has to be relevant to their needs. That's the general rule. And that's how you teach it. You have to teach your trainees, other therapists, that if it's not relevant to your patient's needs, then there's something else going on.
Yeah.
Right?
And and what about the problem of the client taking more space, more room, and asking you more and more about your experience, as he hears about you are willing to share something of your own.
Again,
how to teach the client, how to teach the
you don't have to really
therapist to teach the client not to.
Well, that's just setting limits, like you would do with a child. There's certain things that our children are not prepared to know. It's not helpful for them to know. It's not appropriate for them to know. If you're a good parent, there's certain parts of your experience and your personality that you'll protect your child because it's not age appropriate. It's not relevant. If I have a patient who's looking for a lot of really personal information about my life, it would be natural to be curious. Human beings are curious. Some human beings, especially narcissists, believe that the more information they have, the more they can control the situation, and they want to control it not to hurt you necessarily, but to protect themselves. So they may be very intrusive and ask a lot of questions, but my answer will just be honest. I'll just say it's not relevant to your therapy. That's private, and in fact, given the fact that I see myself like a limited parenting agent to your vulnerability, it wouldn't be appropriate for me to share that with you. That's something that would be shared maybe with a friend, and I'm not a friend, right? So I'll just say to them, that doesn't feel relevant to your needs. But if you can make the best case for why you feel that would help you in terms of meeting your most important needs, I'm happy to listen. So I put it back to the patient to make the best case why it's important that you know about my sex life. They usually can't. They'll just say, I'm just curious. If you know what it's like to be someone who struggles with intimacy. And I'll say, well, if you're trying to tell me that you're having a struggle with intimacy and you want to know if I know what that feels like because it'll make you feel closer to me, then, in a more general way, I can say, given your experiences, I can appreciate why this is difficult for you, right? I can appreciate it. Have I ever had a struggle in my intimate life? Sure, I'm human, right? But the specifics of my private world aren't relevant to your treatment goals. Okay. You just have to be honest about that, because it isn't.
And have you relationships, friendly relationships with your clients after therapy, after therapy?
No. And my patients will say, could we be friends when therapy's done? Why can't we be friends? And I said, because just like my own daughter, who's 27 years old, I'll always be her mother, not her friend, her mother. Okay. And I will always reserve a space in my heart and in my place, as long as I'm here, for you, like a good parent, like a surrogate parent. I'll always be that. I'll always be here for the part of you that needs me from that vulnerable place. I respect you as an adult. I admire you as an adult. I could imagine you being a good friend. I would like you as a friend. But I can't do that because then I lose the opportunity to be there for the vulnerable part of you. And that's the way I see you. That's my relationship with you.
Thank you for this answer. They're important, very important.
Yeah, we don't have a view of the patient as being devious, or we don't see them that way. We see them as being vulnerable at the core with these very difficult modes that they've constructed to protect themselves. And these modes might hurt people. So we see them as vulnerable at the core. We don't see them as devious. We don't look at them as bad. We look at them as having these constructs to protect themselves that we have to address. We have to confront. We have to try to break down the walls. We have to try to set limits on the parts that are very dangerous or hurtful. But we know that at the core they're vulnerable, right? And calling people manipulative sounds so blaming. So we don't blame the patient. We just hold them responsible.
Of course, yes. Yeah. I just wonder if sometimes they admit to do something intentionally being aware.
Yeah, if they feel like they want you to hurt, if they feel upset, it's what passive-aggressive tendencies can look like sometimes. So you have a patient who, one of my narcissistic patients would always end up coming home late, and he'd say, the more she makes demands on me, the more I'm not going to show up on time. So it's kind of a passive-aggressive way of, is he doing it on purpose? Yes, he's doing it on purpose, but he feels entitled to do it on purpose because he feels like she's being difficult, he's going to be difficult. Right? Doesn't solve the problem, of course, just makes things worse, but they do it anyway.
And so I always wonder, how can they be all so smart? It's impossible. So there is something inside them that guides the
Survival.
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 It's a survival.
It's a different form of survival. They don't go home and cut themselves, like borderline patients. They don't necessarily have the destructive, self-destructive, direct self-destructive tendencies like borderline patients. They have more we call insidious self-destructive tendencies that may, over time, they may get sick from drinking and drugging. They may lose their money if they spend and they gamble, but they're not directly assaulting themselves. So their survival is just different. The survival is very strong, very tough. Some of it, I think, is just temperament. Some of it is watching their family members. But their survival is really more of it's clever. They're clever.
Yeah, very clever, yes. And their moves are similar. All of them has similar tactics, similar strategies.
Pretty similar, yeah.
In the couple relationship, for example.
More or less. Similar modes, but maybe different styles within the mode.
Yeah.
Some detached protective modes are more quiet. Some are tougher. Some of the fighter or self-aggrandizing modes, some narcissists they're not show-offs. They're not. In fact, they're more quiet types who they may be very controlling, but they don't walk around talking about themselves like they're wonderful. In fact, they don't talk to anybody. So they have the same modes, but they show up differently in the modes, some of them. And some are exactly the same. But I wouldn't say they're all identical, because narcissism has a range of possibilities.
Oh, yes. I am struck always when I see the similarities, because...
it's just survival, and they learned it at a very early age.
How
to live in the world, how to deal with the things they feel uncomfortable with. They know how to be charming. They know how to make people like them. And they know how to push people away, even though they don't know they're doing it. But they're not so aware of the outcome. In other words, it doesn't really work, because they end up pushing people away, and they end up having people not like them very much. But they can make certain things work very well in their career. So in their careers, they can be very strong, successful, and powerful in their careers, because they're very good at just focusing on what they have to do, working hard, being successful. I would not use the word manipulation. Yes. I would say they still have those modes, even in the workplace. They know how to survive, and they also know how to be very successful, because they're detached. So you can be a great surgeon. You can't even be a good surgeon if you're not detached. You can't be thinking about the emotions of the family members outside or the emotion of the person on the table. You've got to be pretty detached. The problem is they can't stop being detached when they leave the surgical room, the operating room. But it does make them good at what they do. My radiology doctors, my surgeon doctors, my neurology doctors, they're very good at what they do. They're the top of their class because they're really good at being detached. And they're really smart.
Listen, you are right saying you don't call that manipulation because it is a survival and it is a self defense. But when it happens in the relationship, there are victims because the other side of the relationship may.
Well, there's victims, but you also have to ask. We have to ask the question about the partner who is a quote-unquote victim, why they're stuck. Not to blame them. I don't blame them. I'm just be curious. I'm always curious when I meet women who are partners of narcissists, why are you staying in the relationship? Why do you tolerate this? Why is it hard to stand up to this person? Are they dangerous? Are you afraid? Is it your children? There's reasons, usually. But yes, sometimes they're really suffering from the mental abuse and hopefully not physical abuse, but from being ignored, from being criticized, from having a partner who's just so self-absorbed and shut down. But we have to be curious about the partner too. Why are they accepting
it? Yeah, but it's difficult to put the question why they are accepting without blaming.
No, you have to say, I'm not blaming you. This isn't blame, but I am curious about what makes it difficult for you. I've asked countless women this question. Some of them will say, are you blaming me? I say, absolutely not. But I just want to understand, what is it that keeps you in the relationship? What have you already tried to stand up for yourself? What have you tried so far to meet your own needs? What have you tried even to see if your partner will go to therapy? And they'll say, well, it's not my responsibility. I say, no, it's not your responsibility to fix it. It's only your responsibility to look after yourself, to make sure that you're okay. And some of the women I work with will say that they can't leave because they have little children and they don't want to leave their little children with these difficult men. Mm-hmm. I get it. I respect it. I understand it. It's a big sacrifice, but it's all that they're able to do right now. And some of them love them. They love them. Like I said, part of the reason I wrote my book was inspired by some of the women I was seeing who, they loved these men. They could see their vulnerability underneath the self-aggrandizer or the bully or the critical parts or the detached parts. They could see some of the vulnerability and they loved them. They wanted their partners to be well, and they wanted to support them healing, but they were tolerating a lot of pain to do it. And I always say to them, I'll support you either way. If you want to go, I'll support you to go. And if you want to stay, I'll support you to stay, as long as it's not dangerous and you're safe. I said, I will support you on either side that you want to go, because there's no wrong if you choose to leave, and it's not wrong if you choose to stay. We just have to make sure that you're safe and that you don't have to pay such a high price emotionally either way. Right? So it's really taking a very personal look at the partner and making sure that whatever choice they make is going to ultimately meet their needs so they can be healthy.
And what help them to leave the relationship?
Sometimes it's just a matter of working on their own self-sacrifice issues or subjugation issues, or if it's someone who has strong defectiveness issues and they don't feel good enough, someone who has abandonment schema where they don't feel comfortable being alone and they're terrified that they're going to be alone forever. So just like we would do with the narcissist, we have to work on the schemas of the partner so that they can be, they can free up their healthy, vulnerable self and know that it might be hard going out into the world alone and leaving a relationship, but, if they're staying only because they're like a prisoner to their own old, early beliefs, then they're not really making their own choice. Mm-hmm. You want to make sure that you're choosing from your healthy adult side whatever you choose, that it's coming from the healthy adult, whether it's staying or going. And that choice gets suspended until they really have a good connection with their vulnerable child.
What we are talking about is inside a relationship where the women have less power than the men.
Some do. Some have a lot of power. They just don't know they have it. But they have a lot of power. And some of them are very powerful, actually, in the relationship. And, I mean, especially if the women happen to be the narcissists, they can be very powerful in the relationship.
No, I mean when there is an asymmetry in favor of the male, which is the most common situation.
If they have subjugation issues, issues of abuse, it can feel just like it did when they were very young. Yes. It can feel like that. But remember, this is a woman in a relationship. What I try to help the women I treat realize is that to the part of you that's very vulnerable, this may feel just like it did when you were young. You feel abused. You feel like you don't matter. You feel weakened. You feel less important. And there may be a theme in your life, so this feels just like that to you, and you follow the same order you did when you were little to cope with it. That's not your fault. It's just what you're used to. It's familiar. But you're not that little child. I mean, ultimately what I want the partners to realize is that they're not that little child. Therefore, they're not really helpless. They're not really victims. They're just people who are struggling just like the narcissists. They're stuck in their coping mode. They're stuck in a coping mode where they feel either too vulnerable or they feel disconnected. There's women who even feel terribly disconnected from the partner, and they just shut down. They drink, they eat, they shop, and they don't look after themselves. They avoid the conflict because they feel helpless. That's not their fault. But just like the narcissistic partner, they're also triggered at a very deep level and don't see any way out. And so I don't see it like, the women are helpless victims and the men are these terrible monsters. I don't see that. I see that there's cultural and sometimes generational issues that make for these really traditional, uneven, unbalanced relationships. But once you look deep underneath and you see that, oh, I'm buying into this. I don't have to buy into this. I don't have to accept this. Mm-hmm. That's the way it was when I was little. It doesn't have to be that way now that I'm an adult. I can make other choices. That's not easy. I'm not saying it's simple, but it's important.
If you were some of the anti-violence centers, there are these centers for people.
Oh, sure. Yeah. I used to run a shelter for battered women many
good.
years ago.
So, good. And if they receive ask for help by a person who has this kind of situation of a relationship with a narcissistic person, what do you advise them?
If they're in a dangerous, violent situation, they need to get out.
Yeah, but in this case, it's not the most part of narcissists are not.
Well, some are, but not all. You're right.
No, yes.
Most of them are critical and
yes,
they ignore their partners.
It's just a psychological kind of violence.
It's not even violent always.
Oh,
sometimes
good.
It's just psychological, psychological deprivation. It's more emotional deprivation, or they may be critical. They may constantly be threatening to leave. They may be putting their partner down. Is it a mental kind of abuse? Mm-hmm. So if that's what you mean, a kind of psychological, mental, emotional abuse, yes, it can be. It can feel very abusive. And that's why I said, if someone were to come to me looking for safety or a way out because the emotional abuse was making them so depressed that they were maybe feeling suicidal or just feeling so like they couldn't get well, they couldn't work, they couldn't function, then maybe the best thing for them to do is to leave the relationship or even leave it for a while and take care of themselves.
Yes,
if it's possible, but it's not always possible. It's not always easy to leave.
And sometimes they know they shouldn't, but they don't do.
Yeah, I think because oftentimes their own schema activation is so strong and they have messages in their mind that say, you can't fail.
But the problem is that if you put them in treatment or you send them in treatment, in the couple relationship, they take the role of the bed of the wrong person.
Yeah, see, the problem with
The,
this, Pierre,
and I don't know if
no, it's okay. The problem with this, some of the questions, Pierre, is that there's not an answer that fits everyone. Right? So there's no, I don't make any, there's general principles about the way the personalities look in narcissists. They have certain constructs that we look at over time where we see these aggrandizing sides that are very tough and fighters, right? We see these detached sides that shut down and self-soothe and self-stimulate and disconnect. We see this lonely, vulnerable part underneath. They can be with a variety of different types of partners. Partners who have self-sacrifice issues, partners who are borderline and have a lot of different schemas, partners who are just feel very defective or have abandonment issues. So there's not like a one-size-fits-all when it comes to how it looks in treatment, except that you can predict certain things about the narcissist and how they're going to show up. But the partners can really vary. You can have women who are, or even men, but women who are very strong, and they stay because of their kids. But you can have women who feel very weak. They feel very, very vulnerable, and they're terrified of leaving because they're afraid of looking like a failure or being alone. So there's...
No, I have mentioned the case of the woman who want to live but can't.
Can't because?
Because of psychological reasons.
Okay.
And that's the case
But even psychological reasons there can be many different psychological reasons, right? Lots of different ones.
Because I feel I become alone. I am afraid. I feel guilty for him because I don't want to.
So you have self-sacrifice. There's abandonment.
Yes. If in this case you refer her to a psychotherapy for a psychotherapy, in the couple relationship, she takes the role of the wrong person, the person who must change, who is...
Well, she does need to change some. She does need to take better care to be a stronger, sturdier person for herself. Not for him, but for herself. So that she can make choices that she wants to make, that she needs to make. A lot of women go into psychotherapy when they're living with a narcissist, and suddenly they get healthier. And they look at the relationship and they think, I don't want this anymore. And that's when the narcissist goes and gets help. Because now there's leverage. Now he doesn't have this weak little woman over there that, is going to stay no matter what. Now he has a woman who's healthy and she's a little stronger, and he might actually lose her. And now he's terrified. She's got leverage. And she knows it. So she doesn't use it like manipulation. It just happens to be there. So now she can make the choice. He says, no, I'll get help. She says, okay, we'll give it one more try. And this is when they get help. And if you have the right therapist for the narcissist, then things might work. But unfortunately, we don't have a lot of good therapists that work with narcissists. So then it usually falls apart. But at least she's healthier, right? So at least if she leaves healthier. So that can happen. That's what you want to see happen. Not that she'll leave, but that she's just healthier, so she can look at her relationship, really look at it and say, do I want to be here? And I have some women who say, yeah, I still want to be here because it's better than being out there. I know it's lonely, but I'm okay. I've got good friends. I have lots of things I love to do. And they mean it. They're not detached. They've done the work, and it's what they choose for now. Maybe next week they'll choose something else, but at least they're in a healthier mode, right? I want to get them to a healthy mode no matter what. Whether they're with the narcissist, they're alone, no matter what. I want them to be in a healthy position so that they can make their own choices freely, in terms of what they deserve, whatever human deserves.
What was your most significant experience when you were running the shelter?
Oh, that was a long, long time ago. It was in graduate school. And right after graduate school, I took the job for about a year and a half, and I was running a battered women's shelter then. I guess the most significant experience to me was that all women get abused. You know, that it's not all women of various colors and socioeconomic backgrounds and religions, and that no one was immune. You know, that there were women that came from all different walks of life that would show up at that shelter. And I guess it helped me to appreciate that this was a big problem, that it wasn't just a problem of the poor or a problem of the minorities. It was a problem of women, you know. I'm a very big advocate for, you know, the anti-violence acts against women and human trafficking issues and anti-pornography and all that. I mean, so I'm a big believer in protecting the exploitation of women. And at the same time, I'm an expert in narcissistic men, you know, because I do think that it has to start with good parents that educate little boys to feel healthy enough in themselves that they don't have to be so powerful over women, that they can respect themselves and respect women and respect other people. And so maybe that's how it makes sense to me. But for me in the shelter, what it was most obvious was just, I was impressed with how powerful and strong these women were in spite of all the danger that they lived with. How incredibly resourceful they were, even when they were suffering. And that it happens to all kinds of women, not just one type. And that it's hard work, it's hard to change. I mean, I used to always ask the question, what does it take for them to really...
Oh, I do by myself, don't
No, it's okay. You can
No, thank you.
get it upstairs. There's a dishwasher. And that's it. You want to keep that? You can.
Yes, I can keep.
Thank you, Alex.
Thank you very much.
We'd always ask ourselves, the therapists in the shelter, what does it take? You know, why do some women seem to be able to leave those abusive relationships and others keep going back? Because we had some who would come back and forth in and out of the shelter many times. And it seemed that for some, the change would happen when the children would get hurt. So as soon as the child, if they had children and now the child was in danger, then they would leave. That was it. They were very protective of their children. But, you know, that was a tough experience. That was hard
So
to
young,
see.
yes.
I was in my 20s. So it was hard to see.
And at
But I
that
learned
time,
a lot.
at that time, there were the first researches on the subject.
We didn't even have a law against it then. It was only in the civil courts. It wasn't even in the criminal courts. We were fighting for it to go into the criminal courts. And back then it was only a civil offense in the family courts. And the judges were men. And the judges would just, this is ridiculous. And then a woman is killed the next week by the man that he let go back into the house. It was just so frustrating. It's very depressing, actually. Laws are better now, but there was no laws then to protect the women, really. I mean, there was restraining orders, but there was no real consequence. There was no real leverage, you know, to get change.